Hello everyone, it's Ashley with Amare, owner and founder of Amare Healing Arts, Plastic Surgery Recovery Center, and Holistic Clinic, specializing in manual lymphatic drainage. We have 2 locations in New Jersey, Highland Park and Elizabeth, and I also offer virtual consults. If you're not in New Jersey but still need help with your recovery, you can give the office a call at 732-841-0142 to set up your sessions. We have our post-op shop where we offer post-op supplies like lipofoams and BBL pillows, and I teach you guys how to use those products with the videos that we have on our product page. That's amarepostopshop.com. We also have our online courses where I teach you guys what massages you would need after plastic surgery, when to get your massages, who to get them from, what the lymphatic system is, what lymphatic massages actually are, and all the research that you would need on your post-op massages and finding a lymphatic therapist. All of these links are in our bio as well as in the description boxes, so you guys can go and check that out. I will see you guys soon. Ashley with Amare. Bye. Guys, Ashley with Amare, and I'm gonna need to talk to you guys about something. So let's just all take a nice deep breath, just in and out, because you guys are freaking out, and you're freaking out, and you're freaking me out. Let's just stop all the freaking out. Today we're gonna talk about the whole post-op freak out thing that you guys have going on. Listen, this post-op depression, this post-op blues, this shit happens not just after surgery. All of the information out there on the post-op blues and post-op depression and all of that stuff, there is a scientific chemical reason, and then there's also a trauma reason. Okay, so it's both. But you guys, you're all panicky and freaking out, and don't get me wrong, you have every right to be. The amount of shit that you guys go through, excuse my French, but the amount of shit you guys go through pre-op and then post-op when your doctor basically drops you and you're like, oh my God, what do? I got no instructions, and you're just floundering around and being all crazy because you got no instructions and nobody on your team. I get it. You have every right to freak out, and that's totally fine. But let's freak out with a purpose. So yes, post-op blues are real, and all the information out there on Instagram, Real Self, social media, Facebook groups, all of that stuff on post-op freak out, or I like to call it post-op freak out, but the post-op depression, post-op blues, whatever you want to call it, there's not a lot out there. And a lot of it is when they usually say it's right when you start to swell and you're like, oh my God, what did I do to my body? And you're totally regretting everything, and you're having post-op regret and all this stuff, right? So a lot of people say it's in those first week to 3 weeks after surgery, right? I am here to tell you this shit happens through your whole recovery. Your whole recovery, the whole thing. Because you're alone, you're scared, nobody gets what you're going through. The interwebs is not a real place. It's not a medical place. Nobody's reassuring you. You're getting fibrosis. You're swelling like crazy. You don't know if your incisions are healing right. Some of you still have drains when you come back home and have no idea how to take them out or what to get done to take them out. I know, there's a lot of unknown things. There's a lot of scary things. But here's the thing. If you have a post-op specialist, me, on your side pre-op, you completely avoid the post-op panic. If you have someone even after, so right, I have a virtual client who I love so dearly. She is now my best friend because we've been working so closely together for the past couple months. You know who you are. She is, I want to say, 5 months post-op. And we're now seeing her skin start to retract after lipo, and she had 3 months of fibrosis with no help. And she still freaks out. At 6 months basically, she's still freaking out about little things. And then she's like, I'm sorry for freaking out. And I'm like, I need you to tell me. I need you to be honest with me. I need to know where you're at. I need to know why you're freaking out so I can reassure you and explain the science behind it, so that you understand, so that you stop freaking out. Because the main reason why you guys get the post-op blues and the post-op panic is because you have no idea what's going on. I do these talks with you guys. If you're listening on the Spotify, thank you for listening. Come join us on Instagram. If you're on the Instagram, come join us on Spotify. Or Anchor or Google, whatever podcast platform. But I do these talks and do these videos for you guys to try and give you as much information as possible so that you don't freak out. Because you won't freak out if you know what's going on. If you understand the why, then you'll be like, oh, okay, all right, I get why this is happening. This is normal. Or I get why this is happening. It's part of the process, whatever it may be. Now, here's the thing. When you guys freak out, it's because somebody told you somewhere or didn't tell you that these things were going to happen, and now you're freaking out. Or you didn't know that you were supposed to get massage, or you didn't know that your faja was cutting into your BBL because you did no research on it. And then you start freaking out, and then you start panicking, and then you start making really rash decisions, like not wearing a faja or scheduling with the first available massage place, and then you wind up getting massive fibrosis because it's a legal squeeze massage. You guys make all of these rash, drastic decisions out of panic. Now, in a perfect world, it would be great to say, oh yeah, I'm going to see Ashley pre-op because she offers pre-op, and I'm going to ask her 1,000,001 questions, and she's going to throw thousands of words of information at me that my head can't even comprehend, but I'm going to write it all down because I'm going to need it later, and I'm going to get all my supplies, and she's going to teach me how to use them, and she's going to explain what exactly lipo is, or what exactly medically is going on during your procedure, what to expect after your procedure, what to expect as far as swelling, what to expect as far as fibrosis, what to expect as far as a garment, all of these things, right? In a perfect world, you would see me pre-op, and I would mentally prep you and give you way more information than you need to get you ready to completely avoid the post-op panic. But this is why it's called post-op panic, because it's after surgery when you didn't do enough research, or you listened to the wrong people, Real Self, Facebook, Instagrams, the webs, the interwebs with all the randos out there who aren't licensed medical practitioners. You're listening to all of them, and you're not even learning the medical science. You're just listening to what they say blindly. You're not even like looking into it. And then you get to your pre-op, and none of that stuff you learned applies because it wasn't medically backed, and because it wasn't medical fact, and because it wasn't anatomy, physiology, biology. It was just something somebody said somewhere about post-op, and that was it. So when we're talking about the post-op panic, 99.99999% of post-op panic is because you have no one on your side. You don't have me for every single road bump. You don't have me letting you know that these things are normal so you don't panic. You have no support. You're going to a squeeze massage person who's not answering your questions. Your doctor is not really giving you much information. The nurse isn't giving you much information, and you have no idea if any of these things you're going through is supposed to happen. So you go on the interwebs, you go on Real Self, you go on all this stuff, and it makes you panic more. Guys, if you are experiencing post-op panic, post-op freak out, please, God, find yourself a professional. Do not go to Real Self. Do not go to late night TikTok. Do not go to all these random Facebook groups with other post-op freak out people. Guys, the worst thing you could do is have two people who have anxiety in the same room, because then you just have sonic resonance of anxiety. You have all of these people in post-op freak out, which is why they're late night sliding into people's DMs and on these Facebook groups, because they don't know. They have no guidance. They have no idea what's going on. So they're just trying to share their experience to see if anybody else is experiencing the same thing. But just because two people are experiencing the same horrible thing, one, trauma bond, two, neither of you are a licensed medical professional and know if this is normal, three, you're guesstimating and estimating and making all these assumptions about your healing based off of what other unlicensed bad people are like putting out there on the web. Like, it's just this big downward spiral. The first thing I tell you guys when you step foot in my office for that first appointment, and I'm throwing all this medical science at you, explaining to you why everything's going on, calming you down, the number one thing I tell you is, while you are under my care, you are not on Real Self. You are not on Facebook. You are not in the post-op groups. You are not listening to unlicensed people who have just been going through surgery, struggle busting their way through, and not having any medically backed care. That is the first thing I tell you, is stay off of there. Because then every word out of my mouth that is medically backed that I am telling you, you are going to question over and over and over. And you are going to continue asking me the same questions and continue being confused because you're hearing conflicting information. And this right here, the thing that I just said, conflicting information, is the number one reason for post-op blues. Why? Because you hear all this trash that's not real, that's not any kind of scientific, and then you get to post-op and it's not real, and you're freaking out because now this is like something completely different. You guys that find me pre-op, you guys that even find me post-op, the minute we get you on the Amare protocol, the minute I start explaining everything that I explain in my videos in detail, probably more detail than you even need, but I go through every single thing and make sure you know more than you could ever possibly want to know about what's going on with your body and make you understand it, boom, post-op blues gone. Completely cured. Like, you have no more guesswork, you're immediately calm, and the next day you walk into my office, you're like a whole different freaking human, and you're telling me things that are going on with you and explaining them to me because now you have the knowledge to do so. So, the post-op blues thing, when you're like, oh my God, why did I do this? This was the worst decision ever. I look worse than I did before, and you're being all like spiraling, which again, guys, is totally normal. This is a major thing. You're not talking about just getting a bad tattoo. You're not talking about a late night, decision that you made rashly. You're talking about a major, major, major surgery, even if it's lipo, that has changed your body. And now you're panicking because you have fibrosis and swelling, and it's not just poof, magically you have a new body. You have to put in the work. The same way you would have to put in the work at the gym, you got to put in the work after surgery. You had to put in the work. You didn't know you had to put in the work because all these people on Real Self were just like, oh, look at me 2 weeks later, no faja, my body, blah, blah, blah. And you're like, oh, okay, that'll be me too. And then it's not, because that's not how the body functions. And now you're freaking out because you got no one on your side to tell you, hey, it's going to be okay, number one. Number two, medically and scientifically, here's why it's going to be okay. And number three, give you all the information that you're so confused about and so lost with. That's why post-op blues and post-op craziness happens, because you guys aren't calming your minds and mentally preparing for surgery. You're TikTok and Instagram preparing for surgery. Let me put it to you this way, okay? When you're dating, right? When you're single, okay? And you have somebody who late night slides into your DMs and is just like, "Ayo, girl, what's up?" And you're just like, ew. No. Versus when you have somebody who sees you in a bookstore and goes, oh, what book are you reading? And starts an actual conversation and actually cares to hear what you have to say and actually genuinely makes a connection. Versus, ayo, girl, what's up? That is the equivalent to you doing actual post-op research and finding a licensed professional like myself or Kathleen, who I mention all the time, or Kathleen, or an actual licensed post-op professional who's putting out professional medical information versus TikTok people or Real Self people or the Facebook groups where people are not licensed, they're just sharing random experiences. That is exactly what that is. It's the same thing. It's the quality of the research you're doing that gives you the post-op blues. So, had a client, saw me pre-op, then was supposed to see me post-op, life got in the way, didn't see me post-op, saw her today. Okay. All of the things that could have gone wrong went wrong. Why? Couple reasons. One, she couldn't get in to see me. She didn't have the support because she had other stuff going on. Two, she's now freaking out because now I'm showing her all the things that went wrong. Three, she also knows that now we have a plan of action. Now we know what to do. Now we know why it got there, when it got there, how it got there, how to reverse it, how to get rid of it, how to fix it, and how to get to the end. Versus just freaking out. Now this client, she set up a virtual with me and we did the virtual. And she's not too far from me. She's about an hour away. She's in New York. And she has massive fibrosis, garments all over the place, all this stuff, right? Did her research and found me through TikTok. Am I saying TikTok is bad? No. Am I saying Real Self is bad? Yeah, honestly it is. And I'll do a video on that later. Am I saying the Facebook groups are bad? No, because they do lead you guys to education that's beneficial. The problem is, how do you know what beneficial education there is? How do you know what that is? How do you determine? Well, like my client this morning said, it's the vibe. It's honestly if you fully understand, because one of the things that she decided to schedule with me for is because of the fact that I go into detail and explain everything versus the 5 other videos on TikTok she saw before my video that came up on her feed where it was just like this is what fibrosis looks like. Boom, that's it. Or I'm using a board for fibrosis. Boom. But no explanation, no medical backing, no science, no real conversation like this, or I'm getting into the nitty-gritty of it, where you're really understanding what's going on. So, that being said, when you are doing research, as I air quote with my fingers, research, you need to make sure, and I'm saying this in every video now, there is medical professionals doing this. Now, mind you, I am licensed by the state of New Jersey as a massage therapist, but I am a lymphedema certified therapist. I am a medical grade post-op compression fitter. I am a post-op specialist. I am a manual lymphatic drainage therapist. I am a medical massage therapist. I specialize in neuromuscular therapy, trigger point therapy, myofascial release. All of the stuff I do is medical. Granted, my license is massage therapy. I am like the most medical that you can get and the most technical. There are people like me out there that are very heavily medically inclined to do what we do. Am I a doctor or a nurse? No, and I say that all the time. I am not. But I can read your blood work and understand everything on it. I have bajillion holistic health certification hours, whatever. I've taken classes designed for doctors. I was at the New Jersey Plastic Surgery Conference with surgeons. I'm learning with the doctors at the same time, in line with them. I am the opposite end of what they do. So when you are looking for someone because you're freaking out in post-op panic, you need to find someone that can medically interpret why you're freaking out, that can actually give you the support you need. Because just somebody doing squeeze massage is not enough when you're in post-op freakout mode and will make it worse because now you're in pain and freaking out. Somebody who's just going to do lymphatic massage and tell you, oh yeah, it's fine, whatever, like you've got some fibrosis, wear this, call it a day without any explanation. Why would you listen to them? I would never expect you guys to listen to me or take anything I say at all as to meaning any kind of credibility if I didn't back it up with actual fact. If I can't prove to you that this works, like arnica tea, I'm not offering it. If I can't prove to you that there is medical science proving that this works and why it works, I'm not offering it. Because who's to say that you're going to believe me when I say it works? Where's the proof that it works? Just because I have other clients that it works for doesn't mean it's going to work for you. I don't ever offer a product or do anything with you guys unless I have medical and actual hard fact science to back it up. The end. That's what you want post-op. That's what's going to cure your post-op blues, is that concrete assurance, is that concrete knowledge, is that concrete explanation. So if you're freaking out going through this whole post-op panic, post-op blues situation, it's because you don't know enough. You're floundering around without any support. The people that you've trusted and turned to for support, like your doctor, your surgeon, patient care coordinator, nurses, people like that, recovery house. Ugh, it's the worst place to go for that. Those people have let you down, and that's why you're freaking out. Because you have no support, you've got no one on your side, you've got no one helping you, you've got no one that's going to tell you, hey, you're going to have these 5 roadblocks for the next 3 weeks, here's how we're going to navigate them, here's our plan, let's get to it. Let's go. Let's do it right now together. And every step of the way checking in with you. When I do my sessions with you guys, yes, your massage part of it is done with Melissa. I also do the massage part of it, but your package is broken up. You see me for all of your roadblocks. You're never without me, unless you choose to be, unless you're like, you know what? I'm good. I'm just going to do my massages with Melissa. She's great. She knows what she's doing. She's super detailed. I'm just going to go do that. Totally cool, dude. If you feel like you got it, awesome. Do it. But I do not abandon you guys. I am there for every drain, after every drain gets taken out, after your steri strips fall off, every time you get into a new garment, checking your fibrosis at least once a week, you have a session with me. I'm not just like, all right, well, I told you what you need to do. Here you go. Go do your sessions with Melissa and follow the rules. No, I'm still there. Because one, even if you don't need me to remind you of the rules, I still need to make sure you're following them so the protocol works. 2, you're going to have questions. A lot of questions. And I'm not just going to sit here and be like, oh, okay, well, I already told you. Go watch a video, call it a day. No. They're specific to you. Your treatment plan is specific to you. Your post-op recovery is specific to you. And 3, emotional support. How am I going to expect you guys to follow the rules of post-op that I've put in place in the Amare protocol if you don't understand why and you don't feel supported? If I'm not there explaining to you like, hey, this is what's going to happen and here's why it's going to happen and here's why you should follow these rules, and I'm not encouraging you to do that, why would you ever listen to me? You wouldn't listen to me. And honestly, even when I do that and I say, hey, here's the timeline, here's what you got to do, here's the way you got to do it, blah, 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 blah. Guys, it's a lot of information all at once. You're not always going to remember all of it. If I had to tell you, all right, here's what you're going to expect for 6 weeks, here's all the things you need to be doing for 6 weeks, write it down, here's your plan, have fun. You're not going to remember half that shit by week 2. There's no way. Because it's so many different stages of healing that your body goes through. There are so many different little roadblocks that we come into contact with. Like I said, different stages of fibrosis, different stages in your garment, different stages of wound healing. Yeah, I could say, okay, yeah, that's normal. Just go through it and experience it. But the biggest point of post-op, first of all, you're not going to look like yourself anymore. The self you used to look like. You have a brand new body. Second of all, during post-op, you sure as hell don't look like yourself. You're a mess. You're supposed to be. When you guys come into my office wearing super tight jeans over your faja and like a tiny little t-shirt, I look at you like you're freaking crazy. You should be coming in a bathrobe or PJs or a sundress or something that doesn't look cute, because you should not be looking cute right now. You're in resting phase. You're in recovery phase. You should be comfortable. You should be as comfortable as you possibly can be. You should not be worried about shaving your legs. You should not be worried about looking pretty and putting on makeup. You should look like a hot mess for about 3 weeks, because that's what we need to heal. Because then I know you're comfortable, you're focused on what you need to be focused on. You're not doing other things outside of that because it's going to make you uncomfortable. Like trying to get dressed with a faja is a mess to begin with, and you're trying to put on jeans over your faja to go out in public. Now I understand that sometimes makes you feel better. Putting on makeup makes you feel better because you are in this healing phase. You are in this phase where like you feel like shit. Your body's falling apart. You're like in pain all the time and you can't function and you can't like walk right because of a tummy tuck or lipo or BBL. You can't sit. You can't do normal human things. So you do the things that we do to make ourselves feel better. That I totally understand and that I totally agree with. But what I don't agree with is you guys freaking yourselves out all the time, thinking that you should be at some magical phase just because someone else on Real Self is, or that you're supposed to look like you're 6 weeks post-op at 2 weeks because someone else on Real Self looks like that, or someone else in your Facebook group isn't wearing a faja anymore, so why do you have to? This is why I say this whole post-op blues thing, the first part of this video, the whole post-op blues thing is completely your mentality. Because you're on social media, because you're on Facebook, because you're on Real Self, because you're on TikTok, watching all these other people who are not you, who are not your body, who do not heal at the rate that your body does, who are not on the medications that you are on, who did not get the same exact surgery as you, and you're comparing yourself to them, and you're driving yourself insane. Now, you're also freaking out because you have no support. That's the other emotional. There's 3 parts to post-op freak out. There's the mental, the whole I should be blah, 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 blah. Stop shooting on yourself. Number 1, no more shoulding. You shouldn't anything. You are right where you are, and that is it. Number 2, the emotional part. You expect more of your doctor. That's what I hear all the time. I just expected more because it's cosmetic. I just expected that they would tell me this. I just expected, like, no. Guys, when you get a knee surgery, the surgeon does the surgery. They send you to physical therapy. The doctor is not rehabbing you. The doctor is not calling you to check in and see if you went to PT. The doctor is not sitting there doing your PT. When you get surgery, you need to do the aftercare. The same way, if you got a knee surgery, it's your responsibility to go to PT and pick a PT place. It is your responsibility to find a post-op specialist, a manual lymphatic drainage, Vater style specialist, and go get your massages done and wear your faja and take care of these things. Yes, your surgeon may point you in the right direction the same way a normal knee surgeon would say, hey, go get PT. Yes, your surgeon is going to say, hey, you should probably go get massages, or you can start your massages now, if they even say that much. But they're not going to sit there and tell you exactly where to go, exactly what to do, exactly everything all the time. They're not going to do that. So, again, that's the emotional part of it, where you feel like you've been abandoned and you're lost and you're confused and you're alone and there's no direction. Then there's the chemical part of it, which we're now going to get into. Guys, you have general anesthesia from surgery in your body. You're on oxys or perks. You're still in a lot of pain on top of that. And you're on sometimes blood thinners, sometimes nausea meds, sometimes like sleep things like Valium or Zofran or something. And on top of that, you're on your antibiotics. Your chemistry post-op is off the charts. You have so much going on inside of you. And beyond all of that, you're in pain. You're in a lot of pain. And even beyond being in a lot of pain, like, it's uncomfortable and you don't feel human and you don't feel okay and it's overwhelming. And the actual chemical part of your body, as far as the pain with the adrenaline and the cortisol and all of that, will make your mind go nuts. That's how that works. Brain chemistry, it's all about your hormones and your receptors and all of that. So the meds can sometimes do that. They can make you a little crazy and a little depressed. Number two, your actual pain receptors and your pain response will also drive you literally nuts and make you crazy. But if you have someone like me on your side that's a post-op specialist that knows all of these road bumps, all of these things that you're already thinking, everybody tells me all the time, like, I basically read their minds because I've done it so many times. I know all the things that you're going to encounter and I can tell you how to navigate them. Sure, I don't know everything. Nobody knows everything. I don't know all the things, like absolutely everything. But I know enough to tell you the timeline and the major things you're going to encounter and help you calm down with that. This is also why I stress, again, gallon of water, having green juice, not having things that are like caffeinated or stimulants or anything like that, because you're already going through so much with your chemistry in your body. It's going to set you off even more. And that's not what we want. We want to try to keep you calm, cool, collected, straight and narrow path, one line of thinking, point A to point B to point C to point D, all the way until the end of your post-op. We want it to be a linear thing. There should be rules. There should be a trajectory. There should be a plan for you. And you freak out because you don't have a plan, number one. Number two, you thought you had a plan or you thought you didn't need a plan and now you don't have one. Number three, you then run to your surgeon and they're like, bare minimum, you're fine, you're not bleeding, you're not dying, you're swollen, you're fine, go away. And then you feel emotionally rejected. And then you feel hopeless. And then, and you spiral down this rabbit hole of post-op panic. Third part of this video, usually in the post-op panic, you call our office and you're like, oh my God, I need to get in today. And we're like, we're booked out. The next available is tomorrow. And you're like, well, that's too late. I need to get in today because I'm in so much pain and I'm dying. Okay. Well, you can come in tomorrow. Oh, well, I'm going to call around and see if I can find somewhere else. Click. Okay. Rude. Okay. Thanks. First of all. Second of all, you then go and find a place that does squeeze massage. Or you then go and find a hand and stone to rub you with oil. Or you then go and find someone who's going to do wood therapy or cavitation or something extremely rough on your body. It's then going to cause fibrosis. You are then going to freak out even more because now your swelling has hardened, and although it may be compacted and you may look smaller, in the weeks to come, it's going to become very painful. And after your 6-week mark, you're going to freak out even more because now, oh my God, this isn't going away. Oh my God, what did I do? Oh my God, oh my God, oh my God, oh my God. Then you call us again and we tell you, yeah, it's going to be about 4 days and then we're available. And you're like, okay, well, you know what? At this point, I'm desperate. So I'll pay it. I'll pay it and I'll wait. It's fine. And then you come in and I meet you and you're a neurotic mess because instead of waiting the 1 day to see me, or instead of just waiting for the appointment and calming down and being like, you know what? She'll take care of this when I see her. I've watched her videos. I know what's going on. It's okay. Like, it's fine. You freak out. You go somewhere else and you mess yourself up even more. Now you're spending twice as much money on your massages because you need twice as many. Now we're waiting twice the timeline because your fibrosis needs to dissolve first and turn back to fluid, and then we have to get it out of you. Now you're in your faja twice as long with your foams twice as long, and you've just made the whole situation worse because instead of panicking, you could have just waited and gotten it done properly, but you panicked and you choose to do something you shouldn't have. Or if the other end of this, you have a pre-op with me, I tell you what you need to do. I tell you don't let them touch you when you're out in Miami and don't get squeeze massage. You freak out because you're so swollen and you're in so much pain and you're like, well, I didn't have any other choice. No. You did. You could have told them to keep the grubby little paws off your new body and not cause fibrosis. Just because you were swollen and in pain doesn't mean you should go do things to your body that makes it worse because you're freaking out. You absolutely have a choice. You chose to cave under the post-op pressure and go get squeeze massage, and now it's going to take us twice as long to get rid of your fibrosis, and twice as long to heal your body, and twice as long in your faja, because you didn't want to pay the money, because you didn't want to come in, because you didn't want to schedule the way you were supposed to. So you winded up out in Miami without all of us here at Amare supporting you because you didn't want to come in before. And now you just made it worse. And now you're going to have to be here twice as long and spend twice as much. Or, third scenario, you see me, you're all kinds of messed up, you're freaking out and panicking. I tell you what you need to do. I tell you what the next steps are. I tell you when you need to come in. You then, because you start feeling a little bit better, or because you've been living with the fibrosis for 6 months now, you're like, I don't want to buy another faja. I don't want to come in for any more sessions. I don't want to do any of that. I don't want to spend the money. I don't want to. But then you're going to go and slide in everybody's DMs on Instagram to try to find some sort of like way around it that it's magically going to help. Guys, if you don't put in the work, it's not going to work. That's it. The same, and everybody thinks that getting plastic surgery is like a cheat code to working out, right? Like, oh, I got my body done, so I didn't have to wait the 3 months of working out. I didn't have to do the diet. I didn't have to do the exercise. I just got my body done and now I'm better. Post-op is 10 times more work than going to the gym. It's 10 times more money than going to the gym because you still got to wear your faja. You still got to watch what you're eating. You still have to drink enough water. You still have to be moving. You have to do all of those things and more for post-op. So just because you're panicking and freaking out, you have fibrosis, you come in, we tell you what to do, and then you're like, I don't wanna, I'm not gonna. Or, oh, what do I do? This and this and this happened, and you're trying to DM my team to get to me, or you're trying to call and ask questions to get to me. I already told you what you had to do, but you didn't want to do it. That's it. You guys don't want to do it. And then you keep freaking out, and then you keep doing the post-op freak out thing. And I keep calming you down, and then you freak out and don't do the things I told you to do and keep listening to everywhere else all over the place. You guys have to pick one source. And I say this to you all the time because I will have clients who are working with me but then working with someone else at the same time, or they're getting some of their massages with me and then some squeeze massage, even though it's illegal and we know this, and I have evidence proving this on my Instagram, even though we know it literally doesn't work, and it actually does the opposite and causes fibrosis from my tons of videos and medical science on my Instagram. Even though, you still in your head, you're like, oh my God, well, everybody else is getting 1 million massages, so I need to do that too. So because you don't have the availability, I'm gonna go and do 1 million massages. Oh, dude, do whatever you want. Like, we're here for you for whatever you need. If you want to do half your massages with us and do the rest somewhere else, you absolutely can. We're not going to stop you. And we're not going to, like, reject you as a client because you're not listening to us on the full protocol. Whatever you need, we're here for. That's fine. But if you're going to go and get your massages with someone else at the same time as getting them with me, do not expect the same results. Because you're messing your body up at the same time as trying to fix it with me. It's not going to work the same way. So yes, you're going to feel two different things, and they're going to tell you crazy shit that doesn't make any sense, that's not medically correct. And then I'm going to tell you the medical science as per the medical textbooks, and you're going to be confused the whole time. Or you're going to come to me and do some massages with me, and then because we are $140 to $170 an hour, if you're not on a package or if you're not committed, you're going to go to someone else who's cheaper doing squeeze massage or rubbing you with oil, do 10 sessions with them, pay $700, and then wind up coming back to me afterwards because it didn't work. And then we have to restart your protocol all over again because you were in post-op panic, listening to the interwebs, doing whatever you were doing. This whole like back and forth thing, guys, and this is when I say, pick one person. You're either going to listen to me and follow my protocol to the T, or you're going to listen to everybody else or whoever else you're listening to. Because nothing I say is going to work if you're contradicting it with stuff that is not medically proven and following 10 different people's advice. You got to pick one person. That's it. Amare, completely medically, scientifically backed. Everything that I tell you guys is science you can Google and find in medical journals and find on Google, find on YouTube that doctors are talking about. I didn't just pull this shit out of thin air. Like, I didn't make this up. I'm not just telling you things to tell you things. This is all medical science that I'm just bringing to you guys on a silver platter. That's what we do. If you're going to follow us, you're following the medical science. If you're going to follow someone else, you're following their word. And whatever their word is what you're going to get out of it. That's it. If their word is not the things I'm telling you from the medical textbooks, can't say that it's going to work. And if you're following us, it works because it's medical science. And if you're following them and us, you're not going to wholeheartedly follow us. You're not going to wholeheartedly commit. You're always going to be confused, and you're going to have post-op freak out for months on end because your brain is being torn in two different directions. You have to pick one person. And if the person you've picked to do your research with, and if the source that you've picked to do your research with, as you're in post-op land, as you're in the post-op timeline, is not working, you may want to consider listening to somebody else who's telling you something else that is starting to make sense, because this is the biggest problem. Everyone you listen to in the post-op world and everything that you're doing doesn't make sense to you, but you're still doing it because it's a part of the post-op world. If it doesn't make sense to you, why would you be doing it? You guys just paid thousands and thousands and thousands of dollars to make your body right. And instead of finding the real deal to listen to and the real medical science and things to follow, because that's going to make sense as I explain it to you, you're going to listen to somebody who doesn't explain anything to you and is just like, well, do this. Here you go. Wear a board. Wear this faja. That's it. You're good. With no explanation, you're going to blindly listen to them. You have to have a team of people to take care of you after surgery. You have to have at-home people. You have to have emotional support people. You have to have your doctor or your nurse directly out of post-op. And then you have to have somebody that's on your side that's going to advocate for you and tell you what's going on and explain to you what's going on for every single road bump and every single freak out. Guys, a while ago, I posted that video about that recovery house lady saying that her patients were Krabby Patty and pissing her off, so she'd send them to the ER because she didn't want to deal with them. That doesn't happen ever. Like, that's not supposed to happen. When you have a post-op person, a real post-op person like me, like my virtual, my bestie, my girl on the virtual who's in the comments right now, she will literally text me or call me and be like, I know I'm freaking out. Like, mind you, we're 6 months out. I know I'm freaking out. I'm not complaining. I'm just saying. And I'm like, I need you to tell me. Give me more. Give me more. Freak out more because I need to know what's going on. Because I need to know. If you're freaking out, you should have a therapist who's going to give you the medical support for your brain, the mental, medical science, the emotional support to calm you down because you're going through a major, major life milestone of a new body, and the actual getting a plan together guidance that you need. That's what your post-op person should be doing. That's what a post-op specialist should be doing. If they're not, and they're just doing squeeze massage, and they don't even speak English, and they can't give you that support, you may want to consider something else. Because that's not what you need post-op. You need someone to be on your side. You need someone who is on your team. That's what you need post-op. Not Real Self, not Facebook groups, not all this other stuff. You need someone who is going to be there to answer your medical questions post-op. That's why you would get a post-op specialist. So, to wrap up this giant rant, when we are having post-op freak out, number one, know that it may be the meds, and you need to drink more water, eat more greens, and chillax. With that, with the whole mental thing, that's chemistry that will happen. Stop beating yourself up for having post-op freak out. Number two, it is emotional. You feel like your doctors abandon you. You feel like the nurses aren't telling you what they need to. You feel so confused because you have no idea what to do, and you just overall feel hopeless. That's the emotional part of it. Three, the actual plan of action doing something part of it. You either do things that are super rash, like booking a person, whoever is the most available, because I need to get my massages now. Because number one, you don't understand why you're even getting your massages. Someone just told you to because you did bad research. Number two, you're in pain, so you're looking for help. And number three, you're desperate because you're in pain and you're freaking out and you're looking for help, and you didn't really have anybody explain to you why you would even need massages post-op. So you think, oh my God, I need to do them immediately and I need to do them right now, and I don't even care. I just need to get rubbed. Like, no. If you don't know why you need these massages, go watch my video on them. I have several videos on them on my Instagram, first of all, and YouTube. Second of all, Your massages are meant to take swelling down. Number one. Number two, they are not supposed to be painful. If you're already in pain, why are you calling and looking for places to just rub you down with oil? That's going to hurt more. Or do incisional drainage, which is going to cause fibrosis and tissue damage and hurt more. That's not how that works. Number three, if you're getting true manual lymphatic drainage, you should be in your compression garment and you should be fine. Just because you have to wait a day, just because you have to wait 2 days, just because you have to wait 3 days. I get everybody in within the week. Even if you have to wait 2 or 3 days, you're still going to get the relief you need. You're still on the pain meds. You're still healing. Why are you freaking out about coming in immediately today at this very moment? You need a massage immediately because somebody put bad information in your head telling you that you needed it immediately. And I tell you guys this all the time. If you can't get in immediately, number one, it's not going anywhere. It's not. It will sit there and turn into fibrosis if we don't deal with it. Number two, calm down. It's not going anywhere. You're not going to immediately turn into a fibrotic pumpkin if you don't come in the next day after surgery. It's still going to be there. We're still going to be able to take care of it. We're still going to be able to get it out. That's how it works. And if you know nothing about the lymphatic system, if you know nothing about post-op massages, if you know nothing about manual lymphatic drainage after surgery and why doctors tell you to go get a massage, watch my other videos to understand the science behind it. Because once you do, you won't be freaking out anymore. And we then have the flip side of it where people call and they're like, oh my God, I need to get these done after surgery. I'm coming back home tomorrow. When can I come in? Well, you're flying in from Florida, right? Yeah. Okay. When do you come back home? Tomorrow. Okay. Come in the following day. And they're like, oh, okay, bet. Because you called 4 days beforehand. See? No post-op freak out. You were fine with waiting because no post-op freak out because you were preparing. So it was set up. So this is the biggest part of it, is preparing. And I'm going to do an entire video on like the basics of what you need to prepare for surgery. As far as like what you need to do ASAP before you get home, or what you need to set up pre-op so you have it post-op. Because I talk about all these different elements in all my different videos, but I want to do one video where you have it all, and it'll go up on the Spotify and the YouTubes and all of that, so that way you'll be able to like know what you need. There'll also be a post on my Instagram about it, so that'll be in there. But basically, guys, post-op freakout is physical from the chemistry, mental from all the bad people telling you bad things that are completely not professionals that know what they're talking about. And 3, it's painful. You're in pain. It's your body. It's physical, mental, and emotional. It's your body that's making you also freak out because you're looking at this medical mess that you think in your head you've just created, and you're like, oh my God, what did I do? Guys, it's normal. It's okay. You're allowed. But the biggest problem is you're a mom, or you're a wife, or you're still working, or you're all these other things. You're not allowed to just freak out. This is me telling you, Amare, and the first thing I do with you guys before I even get into your surgery, if I already see that you have terror in your eyes and you're afraid, is I literally talk to you a little bit and then I get up and hug you and tell you not to freak out. Because you're already spinning, you're not going to hear anything I have to say, and it's not going to make sense, and then you're just going to have a million questions and be in freak out mode. To break the post-op freak out, watch a bunch of my videos, get your mind right, and then take a breath and realize it's okay to freak out, and you're going to freak out. At every single week of your surgery, you're going to have at least a mini freak out because your body's changing so much in such a short time period, and it's very overwhelming, and you're in pain, and it looks really gross sometimes. You are allowed to freak out. It is normal. That is completely okay. Post-op freak out, post-op panic, post-op blues happens the whole post-op recovery, not just in the beginning. And you are allowed to have that freak out, but you need to do something about it. Something that is educated, something that is the right decision, something that's going to fix all the things you're freaking out about. Not just DMing late night therapists trying to get in at the last minute on their schedule. You need to actually educate yourself and understand what it is freaking you out. Is it your wounds? Is it your swelling? Is it your pain? Is it not knowing anything about your surgery and what happened and what you went through? Whatever it is, you need to really sit with yourself and be like, okay, I know I'm freaking out. I know this is normal. Oh my God, what did I do to myself? Oh my God, okay, why do I feel like this? because this is supposed to be one of the big milestones in my life, like graduating or getting married or having a baby. This is a brand new body. I should be ready to take this on head first and go after it and get that body. Why am I freaking out? Figure out why you're freaking out, and then find the proper resources, medically backed resources, and medically backed people that can point you in the right direction to help you fix what you're freaking out about. But guys, I'm gonna need you to stop freaking out in my DMs, because I can talk to you through this video and I can help you in session. Can't do anything for you over a DM. So if you are going through post-op freakout and you're having a major meltdown, call the office, 732-841-0142. Call Alex, 732-841-0142. Happy Alex in the office. First of all, happy Alex with her annoying ass happy tone. I love her to death. She's my best friend. Annoying ass happy tone. She will calm you down immediately. Like, she's so good at that. She's so good at that. I mean, we've had people that are just like really bad. Like, just like really bad. And Alex has like calmed them down and they've been okay. And then they will apologize for being nasty to her because they were so upset. Like, in the same phone call. Alex can calm you down. Alex can tell you about our virtuals. Alex can listen to what your concerns are. She'll let me know ahead of time in the virtual. And then we can set up a virtual and address all the things you're freaking out about, because you have a right to freak out about them. You have a right to be upset about these things. It's your body and it's a lot of money. Don't ever let anyone tell you, oh, you're just being dramatic. You're not being dramatic. You are freaking out about legit concerns that are very, very, very big and very, very, very important. And you need to have some sort of concern for them. So set up a virtual with me. It's $90 for a virtual, 732-841-0142. We will address everything you are post-op freaking out about. We will pick through it line by line by line. We will form a plan of action for every single thing so that you calm down, and I will explain to you why these things are happening and how to deal with them so that we solve the whole post-op freakout situation, and at the same time, get your body right and where it needs to be and on track with your post-op healing. Whether it be garment freaking out, incision freaking out, fibrosis freaking out, swelling freaking out, whatever it is, we can handle it. We can talk about it. We can fix it. We can find a plan of action for it. So again, post-op freakout's a real thing. We have a way to fix it, just like with everything else. We have a way to fix it, but you guys gotta really take this seriously. Like, post-op freakout is a serious thing, and there's a reason you're freaking out. So let's find the reason and let's fix it. So that is the end of my rant. Guys, take a deep breath, find a reputable source, find somebody who knows what they're doing. If it's not me, I can help you find someone in your area. And that's it. That's all I gotta say for today. So thank you for listening. Thank you for watching. Take a nice deep breath for me. It's gonna be fine. We're gonna be good. It's all gonna be okay. Guys, have a good rest of your day. I will talk to you soon. Have a good night if it is night where you are, or good morning whenever you're listening, and give the office a call. And that's it. I'll see you guys soon. Bye.